healthy tooth is a remarkable biological structure. The outer enamel forms the hardest protective layer in the human body. Beneath it lies dentin, filled with microscopic tubules that communicate with the central pulp. Deep inside the pulp chamber, delicate nerve fibers and blood vessels keep the tooth alive, nourished, and responsive to temperature and pressure. The roots anchor the tooth into the alveolar bone through the periodontal ligament, allowing it to withstand powerful chewing forces. Tooth decay begins silently. Bacterial plaque accumulates on the enamel surface and produces acids that gradually dissolve mineral crystals. What starts as a small surface lesion can progress deeper, penetrating enamel and entering the softer dentin. As bacteria travel through dentinal tubules, they approach the pulp chamber. When infection reaches the pulp, inflammation develops in a confined space. The pulp tissue swells, increasing internal pressure. Because rigid dentin walls cannot expand, nerve fibers become compressed, generating sharp or throbbing pain. Without treatment, infection may extend toward the root tip, affecting surrounding bone. Diagnosis begins with clinical examination and dental radiographs. On X-ray, deep caries appears as a dark radiolucent area approaching the pulp. Changes near the root apex may suggest inflammation beyond the tooth. Digital imaging allows precise evaluation of root length and canal anatomy, guiding treatment planning. Once root canal therapy is recommended, the patient is positioned comfortably. Local anesthesia ensures the procedure is pain-free. A rubber dam isolates the tooth, maintaining a clean and dry working field. Under magnification and focused lighting, the dentist begins the access preparation. A high-speed handpiece carefully removes weakened enamel and decayed dentin, creating a small opening into the pulp chamber. The roof of the chamber is refined to reveal the canal orifices. Infected pulp tissue is then removed using fine endodontic instruments. This process, called pulpectomy, eliminates the source of infection. Next, the root canals are shaped. Flexible nickel, titanium rotary files enlarge and taper the canals in a controlled manner, preserving natural curvature while creating space for effective cleaning. Throughout shaping, irrigating solutions flow through the canal system. These solutions dissolve organic debris, disinfect microscopic spaces within dentinal tubules, and flush out bacteria. After thorough cleaning, sterile paper points dry the canals completely. A clean, moisture-free environment is essential for a secure seal. The canals are then filled using a biocompatible material known as gutta-percha, combined with a sealing cement. Warm gutta-percha adapts to the intricate canal anatomy, sealing from the chamber to the root tip and preventing reinfection. With the root canal system sealed, attention turns to restoring strength. A composite core build-up replaces lost internal structure, reinforcing the tooth. Because endodontically treated teeth can become brittle, the outer crown is reshaped to receive a protective ceramic crown. The crown is precisely fabricated and then permanently cemented, restoring natural contour and appearance. Occlusion is carefully checked to ensure balanced contact during biting. Even distribution of chewing forces protects the underlying root and surrounding bone. Immediately after treatment, the internal source of pressure is eliminated. Pain subsides as inflammation resolves. In the weeks that follow, tissues around the root apex gradually heal. Bone regeneration occurs where infection once existed. The periodontal ligament reorganizes, stabilizing the tooth under normal function. Over the long term, a properly treated and restored tooth can function like a natural one. The sealed canal system prevents bacterial re-entry, and the crown restores mechanical integrity. When compared side by side with an untreated decayed tooth, the transformation is profound, from infection and structural compromise to stability, comfort, and restored health. Root canal therapy is not merely a procedure to remove pain. It is a precise biological intervention that preserves natural dentition, eliminates infection, and rebuilds strength from within, allowing the tooth to continue serving its function for many years to come.